Hey, I'm Dr. Sarah Koenig. Today we're going to talk about detox, what it is and what it isn't. Now, when we think about detox, we usually have a picture that comes up in our mind, maybe from a movie we watched, or maybe from a TV show, or maybe from seeing a loved one go through this process. But we know it isn't pretty, and we know it isn't pleasant. So detox is actually the process of your body kind of flushing out the remaining substances that may be in you. And sometimes this can be very, very uncomfortable because your body and your brain have made adaptations due to the consistent presence of alcohol or other substances. So when somebody goes into withdrawal, that is, they stop using the substance, they typically feel the opposite of what the drug does for them. I'll give you an example. Alcohol is a depressant. It generally calms people down and it can make people more relaxed. It can also make people sleepy. So what do we see in alcohol withdrawal? We see agitation, we see anxiety, and we see insomnia. On top of that, there may be other symptoms, such as nausea or vomiting or even diarrhea. Detox or withdrawal is really a whole body process. Now let's compare that to detox from opioids. Opioids, similar to alcohol, often will result in symptoms that are, again, the opposite of its effects. So opioids tend to relax people. They tend to sedate them. Now, when you stop ingesting opioids, you'll see anxiety rise. You'll see discomfort. You'll see insomnia and agitation. They're very similar. Now, there's one crucial difference between alcohol detox and opioid detox, and that's the medical risk. So when we're talking about alcohol or benzos, and the benzos include meds such as Xanax or Ativan or Klonopin, when we're talking about alcohol or benzodiazepines, some of the adaptations that the brain has made during consistent use can actually be quite dangerous once you remove the drug or alcohol from the system. You can get seizures and something called DTs, which is delirium tremens. So think about that as kind of some psychosis that can even be life-threatening. Now, in contrast with opioid detox, you feel horrible. You really may just want to crawl into a corner and die. But in reality, it doesn't have the same medical risk to it that alcohol does. Now, this is one of the reasons why oftentimes insurance companies will deny a request for their client to be admitted into a detox program if they've only been abusing opioids. So make sure when you go to a detox facility or when you take a loved one that you're entirely honest about all the substances you've been using, because they each have different profiles for withdrawal. Well, detox marks the beginning of a journey of recovery. Once somebody is out of detox, and that could be 72 hours, or it can be 7 days, or even 10 days. It really depends on the substance. Now, the first couple weeks after detox, people are often still exhibiting some of the symptoms of detox, but maybe on a much lesser level. They may be restless, they may still have a little bit of stomach upset, but they're definitely, most of the time, craving that substance because their use of the substance or of alcohol has actually changed some of the networks in the brain. Drugs of abuse and alcohol basically hijack our internal reward system. Our internal reward system is super important, and we would not be around as a species if it wasn't important. But what alcohol or drugs can do in some vulnerable people is hijack that. So now, instead of spending time with your loved one or winning a game or anything else that can kind of give you a good sense of pleasure and accomplishment, in the presence of drugs and alcohol, often those things don't even register. So what happens is that the person gradually makes these changes in their life in which they are prioritizing their use over other aspects of their life, to the point where they're continuing to use even though it's causing medical harm, emotional harm. They may even be risking their career. They may even be doing it even though they've tried to stop or cut down multiple times. The reason why it's so hard is because of the adaptations that the brain has made. So detox is primarily really about getting the substances out of the system, but it doesn't reverse those adaptations. That's where the work of recovery comes in. Recovery is the process of building a life you really are excited to wake up to. Recovery is the process of learning new tools and techniques and being able to reinvent your life in a way that really aligns with your values and what you hold dear. Now, the first couple weeks of recovery, people are often still not feeling great. It really is only when we're starting to talk about the end of week 2 and week 3 when people are beginning to truly be able to engage in recovery activities, whether that's group therapy, individual therapy, experiential therapy, whether it's peer support. As I tell my clients who are suffering with alcohol addiction, your brain has a lot of practice drinking alcohol. Your brain has become great at drinking alcohol. In fact, your brain has even automated the process for you. You feel discomfort? Alcohol. You feel fear? Alcohol. Oh shit, you didn't get the job? Alcohol. Well, those changes take a while to reverse, but they do reverse. They do change because our brains have that capacity. We even have a word for it. It's called neuroplasticity. So after detox, sometimes people will go to residential care. Now, residential care can be very useful, particularly for people who don't have a safe home environment or they're staying in an environment where there's still drug or alcohol use present. In residential care, they're in an environment without drugs or alcohol and with programming that is designed to help them acquire the skills, start to build this resiliency and the drive to rebuild their life. Now, residential stay often lasts about 28 days. Why is that? Well, 28 days is actually an arbitrary number that the insurance companies use to decide when they think you're done with residential treatment. There's nothing magical about it. Whether you stay in residential treatment for 28 days or 45 or 60, it's just the beginning of your recovery process. Now, once you return home and start actually using these skills that you've learned, that's the hard work. That's where the practice comes in. And that's especially when it's important to have support around you, a whole treatment team, as well as your family and friends. So detox is the start of a long journey. And it's not an easy journey, but when somebody has the courage to take that first step and decide to stop using, that's when the rest of us can step in. That's when people need our support. They need to understand that they are worth getting sober for, that their life is worth rebuilding. So at Triangle Wellness and Recovery, we really emphasize a no-shame approach to our clients and to our care. Because what shame does is it continues to drive this cycle of addiction. It causes more emotional pain, and the brain responds by saying, oh, I know what helps with that. Now, recovery isn't easy work, but it is worth it. You are worth it. I promise you this. Now, if this video has been helpful for you, or you think it might be helpful for someone else, please leave a comment and share the video. I'll be continuing to post videos about addiction, trauma, and mental health, and how the healthcare system actually works. I'm Dr. K from Triangle Wellness and Recovery in Cary, North Carolina, and I'm wishing you wellness.